I'm Dr. Gabriel Siquier. It's a pleasure for me to be here. And today I'm going to talk about the redensifying power of cell booster lift. And we're going to go through medical and scientific training. We're going to review the articles and publications that we have about this amazing product. For the ones who don't know me, I'm a aesthetic physician. I'm based in the Netherlands and in Spain, and I'm trainer for Swisscell for 10 years. And university level, I work with the research group Neoma at the University of Girona in Spain, where we develop some of the protocols and where we try to understand better the mechanism of action of this wonderful product. And when we are looking to the aging, because what we have here, this cell booster lift, is to fight against the aging, we have two types of aging. We have intrinsic aging and extrinsic aging. Intrinsic aging, we're going to have genetic and molecular changes. We're going to have telomere shortening. We're going to have mitochondrial dysfunction. And that is going to cause cellular and tissue level impact. We are going to have cellular senescence accumulation, the senescence associated to the secretory phenotype, and the oxidative damage. So at the end, what it makes us age is the reactive oxygen species. If we are looking to the extrinsic factors, we're going to have the sun radiation is the most well-known, but we're going to have also the stress, biological stress as well, because of bad nutrition, the smoking, the air pollution. All of that is going to change the functionality of our cells. And if we are talking from the dermis, we're going to go from a young skin to an aged skin. So fibroblasts, they will start to produce less collagen, less hyaluronic acid, keratinocytes the same, and then the melanocytes, they can get hyperactivated, so they're going to produce more melanin that will damage the appearance of our skin. So we are going to go from a healthy fibroblast that we have on the young skin to a senescent fibroblast that we have on the aged skin. And you can see here on this diagram of the dermis that we're going to go from a full dermis to an empty dermis, a dermis that is losing collagen, elastin, and hyaluronic acid, and the main components of the extracellular matrix. So the cellular aging and the extracellular matrix aging, we're going to have a slowdown proliferation of the fibroblast, the reduction in collagen and elastin synthesis, and the degradation and failure of the fiber structure. So we are going to have less fibers and they're going to be less structured. So all of that will generate a matrix degradation and reduction of the extracellular matrix and the synthesis of these key elements that make a good structure in our skin. If we are looking to the matrisome, so the extracellular matrix proteins, we see that we have 6 types of extracellular matrix proteins. We have the collagens, the glycoproteins, the proteoglycans, the extracellular matrix regulators, the extracellular matrix affiliated proteins, and the secreted factors that they are expressed at 4 ages. We're going to have on toddler, on teenager, on adult and elderly. These pie charts represent the proportion of the 6 components, the collagen, the glycoproteins, proteoglycans, the regulators, and the other ones I just named, and they make up the matrisome in the human skin dermis. We have a total of 263 elements in this extracellular matrix, so we can understand that it's a very complex cellular ambience that we are having there to understand that better. And when there was a study for the extracellular matrix integrity and the aging, they make experimental overview and they make skin punch biopsies were collected from the hip, the underarm, and forearm of young and aged subjects, and these were subjected to compound resolved extraction, generating samples of cellular soluble extracellular matrix proteins and insoluble extracellular matrix fractions. Each fraction was analyzed via mass spectrometry, and they found 2,129 proteins. They were identified along all the samples. These skin biopsies were additionally subjected to SHG and TPAF imaging to visualize the collagen and the elastin within the dermis. The summary of these matrix extractions during intrinsic aging and photoaging, we can find representative SHG images of the hip and the forearm skin from young and aged subjects, showing the collagen fibrils that they are in white, the elastin that we can find here in green, and the nuclei that we can see here in blue. What we can analyze from all of that is that the intrinsic aging produced reductions in the elastin fibers and the cross-linking enzymes. The photoaging results in an increase of pro-inflammatory proteases and elastic fiber abundance. So I love this term, that is inflammation, because we see that the intrinsic aging and the photoaging share common features associated with this chronic inflammation, and the proteomic changes associated with photoaging are evident decades prior to clinical aging signs. So we can see that we are losing solubility of the extracellular matrix, we are losing the structure, and we are losing collagen, but also elastin. We can see in these biopsies that was taken. So what we're going to try to do to restore that is create a fibroblast activation. The fibrotic extracellular matrix deposition is the collagen and type 1 and fibronectin, and then this activation of the fibroblast will enlarge the cell body and will create some mechanical activity, like thanks to the cytoplasmic actin stress fibers and the contractile activity. So it's not only generation of collagen and elastin, but also a mechanical activity that will interact and will improve the performance of the interactions in the extracellular matrix with the different components. If we are looking to the collagen type 1 sources and the approximate content in each tissue, we can see that the collagen fiber structure, fibrils, triple helices of alpha chains and tropocollagen, and amino acid residues. So we can see here the different components, and we can see that is the most important component in our skin, between 80 and 85%, and then we're going to have 3 to 5% of elastin and a very little quantity of hyaluronic acid, 0.33%, that it's going to be a key element because it's going to generate this interaction with the glucoproteins, with the proteoglycans, with the other components of the extracellular matrix. If we look into the collagen synthesis, when we have this fibroblast activated, it's going to start the transcription of the pro-alpha-1 and pro-alpha-2 chains, and they will generate an alternative split chain that will go into pre-procollagen, and then after post-translational modification, we are going to go to have this procollagen. On the step number 2, the collagen peptidases in this moment, they're going to be located extracellularly, that they will do a self-assembly, and they're going to have a fibril arrangement that will generate this collagen type 1 fiber. So we are going to go from pre-collagen to procollagen, tropocollagen, then fibril arrangement, and then the fibril with the self-assembly mechanism. We are going to have collagen type 1 fiber. Step number 3, then we're going to have post-translational modifications, And through an hydroxylation, we're going to have the mature chain of collagen. Arginine is a key element in collagen synthesis. This is why we have it into the formulation of cell booster lift. We can, the arginine will go to proline, proline to hydroxyproline, and then to pro-hydroxy, pro-lysine, and that will generate a collagen deposition. Lysine and proline are the major constituents of the collagen. So if we are able to provide the cells with these blocks to build a better collagen and to generate a higher separation, thanks to the arginine supplementation, we can improve the quality of the skin in a faster way. The L-arginine, it's a key element in microcirculation. The microcirculation will allow to these cells to reduce the skin irritation and two potential health benefits like vasoconstriction, blood pressure, and serum cholesterol. This microcirculation will permit the cells to biologically have a better bioavailability of the key elements that we have in the cell booster lift formulation. Then we're going to have also the biosynthesis of hyaluronic acid that we have an involvement in various cellular interactions. We are going to do an activation of the cell signaling pathways. We're going to do regulation of the hemostasis, and we are going to do interaction with the binding proteins partners, the HA-BPS. And thanks to that, we are going to be able to generate more of this saccharide that is the hyaluronic acid itself. Hyaluronic acid has a bioactive role. We're going to have anti-inflammatory activity in the tissue regeneration. We're going to stimulate the cell activity via hyaluronic acid and collagen production. We're going to have an antioxidant action, and we are going to regulate the local immune response through a stimulation of the cell renewal. So this hyaluronic acid will help us to restore and regenerate the tissue of the dermis. That is the key element that we want to improve via these injections of cell booster lift. We have different molecular weights of hyaluronic acid, and this is important that we understand, because when we are younger, the chains of hyaluronic acid that we have in our tissue, they are a little bit longer. But when we are aging through intrinsic or extrinsic factors, this molecular weight will be reduced. And also the quantity of hyaluronic acid that we have into the tissue will also be reduced. This is because of endogenous hyaluronidase and the reactive oxygen species, the inflammation and the alterations on the other proteins and elements of the extracellular matrix. It's important to understand that for the formulation of the hyaluronic acid in cell booster lift, we decided to put high molecular weight. Why? Because if we put short or medium molecular weight, will be degraded faster by the endogenous hyaluronidase. And the other thing is that as shorter is the chain of hyaluronic acid, more inflammatory response we are going to generate. And we try to fight this inflammation activity of the aging. We can see the decrease on hyaluronic acid through aging, and the depletion, this empty dermis that I was commenting at the beginning of the lecture. The graph that declines after the age of 19 already, and it will continue declining. So to put more hyaluronic acid into the skin will help us to restructurate the whole area. There are other important elements that not only the hyaluronic acid, but some amino acids. They will improve the skin hydration. They will maintain the skin acid mantle, and some proteases will be very good for the filaggrin skin barrier function, and the profilaggrin in the granular layer. So we are going to have different elements that they're going to play key activities depending on the layer that we are going to have. So it's important also to understand that for better understanding the mechanism of action of cell booster lift. If you are looking to the natural moisturizing factor, we can see that the free amino acids, they have a higher percentage, and other elements like calcium, magnesium, and citrate, they are less important, but we need to remember that the vitamins, they are going to act as coenzymes to cellular level. Explain that is a little bit complex. Let's go to discover the check technology. Now, I would like to tell you that is an in-house research, is patented by CELLBOOSTER thanks to the hyaluronic acid expertise. The fabrication of CELLBOOSTER, we are going to have the free hyaluronic acid, that is salt, it's a powder, and we are going to go in a solid phase through a shear deformation, and we are going to pass from free hyaluronic acid to hyaluronic acid reticulated salt. Thanks to the mechanochemical reactor that we have in-house, we are able to create some links between the different molecules of hyaluronic acid, and that will make the molecule to be bigger. As bigger is the molecule, more time is going to take the hyaluronidase to degrade it. And this is important because that means that this hyaluronic acid will be for a longer time into the tissue without the addition of any cross-linking element or a stabilizing agent. Like, for example, we're talking about cross-linking element could be PEG or VDD. A stabilizing agent could be glycerol, for example. This is important from a cellular point of view because we are going to maintain the biological activity of this hyaluronic acid. After that, we are going to add vitamins and amino acids, depending on the formulation. We have different products in our portfolio, and we are going to go through the liquid phase. This, thanks to the check technology, we're going to have a hyaluronic acid complex network. It's not only the hyaluronic acid, it's also going to be the vitamins and the amino acids that we have into the formulation that we're going to do intradermal injection or subcutaneous injection, depending on the specific indication for the selected product. If then we are going to have this stabilized hyaluronic acid, and the distribution of the amino acids and vitamins into this complex molecule will be important as well, because we are going to have progressive and sequential liberation of the active ingredients. That will allow us, for some formulations, to put elements that could be competitors for some receptors. We are going to have interaction, very good interaction with the cell receptors. We are going to have a prolonged and a better bioavailability of the products, and we are going to have resistance to the enzymatic degradation. So this big conformation will resist the degradation. That is why we're going to have it for longer time into the tissue. So summarizing, we can see in this slide the details of the second step of the check manufacturing. After aligning the hyaluronic acid matrix, that will be the step number one, the vitamins and peptides and amino acids they are going to be integrated into the hyaluronic acid network under the influence of high pressure and a cell deformation. That is a patented technology that allows us to stabilize that product for longer time into the tissue once we are injected. And this is very key to understand better the activity of the check complex, because progressively daily will be liberated the hyaluronic acid, the vitamins, and the amino acids, generating a complex action and rejuvenation into the tissue, but also geroprotection. So we are going to be able to target wrinkle, pigmentation, loss of skin firmness through a rejuvenation and anti-aging protection of the tissue because of this technology. This is, again, I want to say, patented and made by CELL. CELL was found in 2010. It's located in Yverdon-les-Bains in Switzerland, and they have mastered in-house production with 2 clean rooms. They have fantastic new equipment with high-tech production, and has gone through ISO, GMP, CE marking. So you have all the certifications that they prove that this product is safe and effective. We have 4 products in the portfolio. We have Cell Booster Hair, Cell Booster Lift, Cell Booster Glow, and Cell Booster Shape. Each one of them with a specific formulation to answer the needs of our skin and, for example, or other parts of our body. For example, Cell Booster Hair is to promote the rejuvenation of the hair follicles. We are going to have a strong support for regenerative aesthetics because we are going to stimulate the cell activity. We're going to replace the damage of the extracellular matrix, and we're going to restore and improve skin functions and skin qualities. This is thanks of the components and the micronutrients that we have in this formulation. So again, stabilizing nutrients, prolonged and sequential delivery of the active ingredients in Cell Booster Lift. So we have really a different collagen stimulator. We can do a standalone treatment. We have it proved, and we have several studies that demonstrate the effectiveness of Cell Booster Lift, or we can combine it with other treatments. Cell Booster allow us to combine it with other injectables products like will be exosomes or PDNR or fillers, and to enhance the result, because we understand better and better that aging is a multifactorial process. So it's important that we have the capacity to understand what the skin really needs to be rejuvenated, and we are able to understand also how we can do these combinations with different treatments. Which vitamins we are going to find into the formulations? We are going to find vitamin B2, vitamin C, tocopherol, vitamin E, and biotin is the B7. We're going to have 80 milligrams of stabilized hyaluronic acid in the 3 milliliter vial. And then we are going to have key amino acids for the skin rejuvenation. That's arginine, glycine, lysine, proline, and valine. They're enriched in vitamins. They will activate and will prolong the antioxidant function, the neocollagen synthesis. They will also decrease the melanin synthesis. For example, vitamin C is anti-tyrosinase and is antioxidant as well. So we're going to reduce the production of melanin. We have the vitamins B that they are cofactor for cell metabolism, and it also vitamin C and A is key for photoprotection. So we are going to protect, we are going to reduce the production of melanin, and we're going to stimulate the cell metabolism thanks to the active ingredients in the hyaluronic acid and the prolonged bioavailability. We are going to boost the natural collagen synthesis through fibroblast activation, pro-collagen hydroxylation due to the vitamin C, and then the glycine and the proline, they will also boost the collagen synthesis as we explained at the beginning of this webinar. So we have a strong antioxidant power. And let's gonna see now the biological function of the hyaluronic acid itself. Will protect the vitamins, like for example vitamin C. They are very volatile, but will also generate mechanical cell resistance and strong tissue hydration. We're going to have a better efficient delivery, prolonged bioavailability, and as we know, hyaluronic acid is an optimal vehicle to transport and protect all of these key ingredients that we have into the formulation. The amino acids, arginine, glycine, lysine, proline, and valine, they also have antioxidant activity. As we saw on the epidermis, they have tissue hydration capacity. They also going to generate collagen synthesis, and they will stimulate blood circulation and wound healing. So improving microcirculation will also generate a better cellular ambience and a better bioavailability of the different products that we have into the formulation. If we are looking here at the hyaluronic acid degradation timeline, we can see that injected natural HA biodegrades generally within 72 hours in preclinical models, and the histology shows temporary epidermal thickening and moisturizing, and nothing more. No collagen stimulation, no changes. That is 5 days after the injection of high molecular weight at a concentration of 5% in the skin is no different from intact. So native unmodified hyaluronic acid, while it's very biocompatible, has a major drawback. It degrades rapidly, as is shown in the histological studies, and the short lifespan means it cannot sustain collagen synthesis of the extracellular matrix repair. This underscores the need for stabilized hyaluronic acid formulations to achieve durable results. To solve this, scientists modify the hyaluronic acid cross-linking agents like BDD, divinosulfone, PEG, and forming a gel-like structure that persists enzymatic degradation rate, however, will change the rheology of the product. And we are gonna lose biological activity while we're winning mechanical capacity. So the new technology like this check technology, we didn't modify it, we didn't cross-link we didn't alterate the hyaluronic acid itself, so we maintain the bioavailability. That is very important, that is key for the activation of the fibroblast. Here we can see this is human fibroblast morphology in cell culture. We can see quiescent fibroblast, and after the addition of a check complex with vitamin C and amino acids, this is without injections, we see the transition of the fibroblast to the stage of synthetic activity. So when they produce their own new collagen, elastin, and hyaluronic acid. So we don't have anymore the senescent fibroblast, we have an activated fibroblast. We improve the functionality of the fibroblast itself, so it's able to produce collagen, elastin, and hyaluronic acid, and to improve the expression, again, of these important components of the extracellular matrix. Let's gonna see now we understand better the mechanism of action, how we can lift and smooth the wrinkles, we can improve the skin tone and the microcirculations. The target areas generally is going to be the face, but we can also use it on the face, the neck, the décolleté area, the back of the hands, the internal face of the arms, and the body. The program is very easy. We're going to do 3 treatments with 2-3 weeks interval, and then maintain supporting course, 1 treatment every 2 months to maintain the results. We have different techniques. We can use papula with an injection angle of 30 degrees, the bevel of the needle up, and the place of injection is going to be intradermal. If we decide to use a cannula, in this case, we recommend the fanning technique, and we were going to use 3 milliliter for the full face, 1.5 milliliter per hemiphase. I recommend you to use cannula 25, but this is adapted to what you prefer. Important, the placement of the product has to be as close as the epidermis as possible, so superficial subcutaneous tissue. It's going to see some evidences of the studies. We can see in this trial, you can find it on PubMed, that we have improvement of 37% of skin microcirculation, improvement of almost 30% of skin density with Dermascan, 12% of viscoelasticity with Cutometer, and 12% of skin hydration with Corneometer, with a very high injection feedback from the injectors as for the patients. We did this clinical trial on 40 subjects between 36 and 55, and they complete the protocol. Was a very well tolerated treatment, and these results are at the follow-up at day 42. In all the subjects, we included hydration values and measured by corneometer baseline, so they need to be less than 60 AU. So that means that we didn't got patients that they got a very low or a very high hydration on their skin, so we could see objectively a proper change of this parameter. The inclusion criteria were all healthy subjects, men and women, and they were Caucasian phototype 2 to 3. So patients that they didn't got any medication during or other treatments during the time of the study. We got some key exclusion criteria as normal autoimmune disease or anti-inflammatory medication, or they got pregnancy, or they were with alterations, hormonal alterations like the menopause. We did the treatment at day 0, day 14, at day 28, and then we measured the results at day 42 and at day 84 to follow up the efficacy and the safety. In the patients, we used the papula technique, intradermal injection. Because of that, we prepare the skin of the patients with a little bit of EMLA cream. We can see from baseline to day 42 with changes in skin density value of more than 29.2%. So it's significant and positive, this change. We also saw a change on the skin microcirculation and capillary floods, 37.6%. This was measured with a laser Doppler. We saw improvement on skin hydration, 12% at day 42. So that means that the product maintains and creates a change into the skin. Also changes in the viscoelasticity between day 42 and the baseline, with 12.5% of improvement. And then we see other parameters like firmness, plasticity, tonicity, elasticity, viscoelasticity. So we see that all of them, they have a positive improvement with P's varying from 0.64 to 0.15. Other parameters we saw, it was an improvement of the skin color. This was measured with skin photography, and we checked the lightness, the redness, the yellow component ratio, the saturation, the luminance. So we can see also significant P on day 42. And as well, we measured through the global aesthetic improvement scale, and most of the patients, they were much improved or improved both by the investigator assessment and also from subject self assessment. Most of the patients that were included in this study, they were naive patients, so they didn't got treatment before. So we saw that it was very positive to see that they saw this aesthetic improvement in their case. We got some variations between men and women, but most of them, again, much improved or improved by the medical practitioner and the subject. We can see that 100% of men, they were improved by the subject. So sometimes men, they're a little bit difficult kind of patient to analyze a change on the skin quality. We also improve the skin wrinkle parameters. In this case, was evaluated by Primus, and we check the roundness, the height of the roundness, and the maximum height of the roundness profile, again, day 7 and day 42. Safety, we got some small bruising, but nothing that it didn't resolve between 24 or 48 hours after the injection. And this is not because of the medical device, it's not because of CELLBOOSTER LIFT, it's because of the way we applied this treatment that was with a needle. Of course, if you do a lot of injections, you can have a little bit of bruising or a little bit of edema. Some patients, they got other adverse events, that headache, migraine, anxiety, dental abscess, but they were not related to the medical device. So yeah, if you have a population of 40 patients, so then they can get sinusitis, a cough, dental pain, but was not serious adverse events. We didn't got anyone, as you can see here in the description. That is 100%. We got some little bruising or a little pain on the area, soreness on the area. We proceed with the injection. Let's gonna see some techniques for the nasolabial folds. We can do retrograde linear technique, intradermal injection, parallel to the skin, and then we will inject around 0.02, 0.05 milliliter on each line with a 3G or smaller needle. I recommend you 13 millimeter. For acne scars, here we can see some results. In this case, it's courtesy of Dr. Mesut Aydin. We have 2 subcutaneous plus 2 intradermal injections. Here, 2 sessions with 2 weeks interval. We can see the regeneration of the skin. It's important to do a little bit subcision in this kind of acne scars that they are hypotrophic to liberate the retraction, and then we can regenerate with the CELLBOOSTER LIFT injection. Here we see also anti-inflammatory activity on this acne patient, and reduction of the scars and improvement of the skin quality. Here we can do also, in this case, was a combination with 1 session of radiofrequency microneedling with 3 weeks interval. If you want to proceed with energy-based devices, I always recommend to do first the energy-based device. We wait 15-20 minutes, and then we can proceed with the injection of CELLBOOSTER on the same day of treatment, because that will help also on the regeneration and on the final result. This is a very good result, only with 1 session, so you can see capacity of CELLBOOSTER of regeneration in some patients. We have very, very incredible results. This case is in a man. Also, again, acne scars. 1 session, this courtesy of Dr. Koray Ceylan from Turkey. This is courtesy of Dr. Gulden Kokumer, also from Turkey. We can see that we have a massive improvement and reduction of the acne scars. So we can see the intensification of the skin. This also 2 sessions. Anyway, my recommendation is to complete the protocol. This is only to show you the capacity of regeneration of this product, but I will recommend to complete the protocol with 3 sessions to achieve the best results. When we are talking about wrinkles and fine lines, and I'm not talking about volume depletion, so we're talking about intradermal wrinkles, we can see a reduction on the brow fits of 25% and on the nasolabial fold of 43%. These were done 4 sessions with 2-3 weeks interval. This is courtesy of Dr. Natalia Mikhailova. This dermatologist, aesthetic physician, and is one of the inventors of this amazing patented technology that is the check technology. Other areas of use could be the body areas. For example, this is one of my cases. We did 3 sessions for striae, and we can see the improvement of the skin quality and the reduction of the whitening and the pearl white areas on the striae. We can also see this laxity of the skin around the navel, how has improved progressively. 3 sessions with 3 weeks interval. This case is from Dr. Etuna from Georgia. And we can combine it with other techniques and clinical cases. We can combine them, for example, within them. We can combine cell booster lift to have a better skin tone and a better skin hydration, and with cell booster glow to attack more precisely this hypopigmentation. Cell booster glow into the formulation, besides the vitamin C, has glutathione, so that also is going to have anti-tyrosinase effect. Because of that, they're going to have also this reduction on the melanin production. In this case, the excess of fat on the double chin was treated with cell booster shape. We have a different formulation that is activating the degradation of the deposits of adipose tissue, and cell booster lift to improve the laxity on this double chin area. Very nice results after 1 injection only. We have different protocols for injection techniques. We have videos that I created together with Swissell of all the injection techniques: the papula, the linear, the fanning, the micropapula, the retrograde. You can request them on your distributor, and they will provide you the way to access them. We also gonna see videos of standalone injection, for example, for atrophic scars. Remember to ask your distributor for this medical video. You can have it and you can review it, and you have very well explained all the protocol, the timing, the type of needle, the depth. There is also a new technique for full face lifting with one only entry point. In this case is with cannula 25G, and we can see an elevation thanks to the vectors we are using with cell booster lift. And in this case, I'm using a cannula 25G. We can see other doctors also in these educational videos, like Dr. Nenad Stankovic has the neck tightening technique, or Dr. Sebastian Torres with the face lifting technique. My technique for the striae. And you can see that we explain from the marking the quantity, if you want to mix it with lidocaine or not, or with other products. You're going to have more and more information. We are going to, both techniques, we're going to use needle or cannula for different areas. For example, the umbilicus, the periumbilical area injection. With some devices, like for example the Juva pen. This video we developed together with Dr. Taskesen from Switzerland, and combination with energy-based devices like IPL or laser. There is going to be the treatment step by step, and always from the preparation of the skin that will be cleansed and the area. Then we're going to apply the gel. We are going to administer the IPL pulses heavily across the area of treatment. We are going to wait these 15-20 minutes to allow the skin to calm down, and then we are going to do the cell booster lift application injections, in this case for, with cannula. You can also do it with Juvapen, so you can select needle or cannula depending of the type of patient you're going to have. Is a patient that is a bleeder, preferably I recommend the use of a cannula. If you want to really place the product in the dermis, I will recommend the use of a needle. We can also combine with hyaluronic acid hydro booster. We're going to do the papula technique with Apriline Hydro. We're having glycerol into the formulation for stabilizing, so it's going to also improve the hydration of the area. And then the Napatch technique with Cell Booster Glow or Cell Booster Lift, depending on the age and the indication of the patient. You can generally use the papula for glow, and then the deep papula or other techniques, depending on the area. You can put more concentrated product in an area that has more pigmentation, and then the rest of the product to divide it in the rest of the face, the neck, the area you are treating. Other combinations, and this is important that we understand the mechanism of actions is nowadays very trending, is combination of cell booster with exosomes. The exosomes are small extracellular vesicles that act as a messenger, and they are transporting proteins, lipids, genetic material between the cells, and their main mechanism of action is intercellular communication. They will enable the transfer of information that will influence the behavior and function of the recipient cell. This can translate into promoting regeneration processes, tissue repair, and modulating immune responses and wound healing properties. Thanks to this activity, and understanding the mechanical activity, mechanism of action difference between cell booster and the exosomes, my plan of treatment for combination protocol, it will be to do 1 week the cell booster treatment, wait, and then next week do the exosomes treatment, and then we wait another week, and then we repeat the cell booster treatment. In this way, we already have the activations of the cells, and the exosomes can influence positively, and we can have a better final result thanks to the combination of both treatments. If we are looking to polydeoxyribonucleotide, PDRN, it shares the effect through 2 main mechanisms: the activation of the adenosine A2A receptors and promoting the salvage pathway for DNA repair. This will stimulate indirectly the tissue regeneration, the wound healing, and will reduce the inflammation. So remember this inflammation that we are having when we are aging, so we are going to reduce the inflammation. So again, I will recommend, as with the exosomes, to do 1 session with cell booster, we wait for a week, we do 1 session with the PDRN, and then we wait another week, and then I will repeat the treatment with cell booster. In this way, we are going to enhance the activity of both. We can combine them, and we are going to have better results for the tissue. So we have 1,000 patients all over the world. We are present in 40 countries. I hope you understood what I explained, and if not, it's now time for questions. Thank you very much. Let's gonna see on the chat. Please feel free to make questions on the chat. And I have 1 question that says, is true if amino acids can activate a standalone, it's need inflammation like collagen stimulation to activate it? No, this is not true 100%. You can have products like, for example, polylactic acid or calcium hydroxyapatite, that to activate this mechanism of action, they will produce an inflammation, and this inflammation will generate inflammatory collagen. In this case, we saw that the CHAC technology is having anti-inflammatory properties, but is activating through a physiologic pathway the production of collagen and elastin, thanks also that we are giving the cell, we are giving the fibroblast the ingredients to build up this collagen. So the mechanism of action is very different. It's true that both you can promote it with different ways, but remember that the inflammatory process, this chronic inflammation, will also make us age. So I would recommend to use Cell Booster in this case. Then another question from Rotem Haroni. How would you combine it with PDRN? Same session or in separate sessions? Well, as I told you, I will do it in separate sessions, but if you want to combine it on the same session, I will not do it on the same area. For example, you can do periocular PDRNR and then the rest of the face with Cell Booster Lift on the same session. Does that mean that they can be injected in the same appointment? No, yeah, I already answered this. I think every product has different mechanism of action, and I want to give time to the product to do its own job. So I will combine it in a different day. So 1 week between treatments. Concerning the scar, it doesn't replace the steroid injection. The steroid injection is working on a different way. You can also combine it, but it depends on the severity of the scar. Normally, what I presented today were hypotrophic scars. A steroid injection, generally, we do it for hypertrophic scars, so it will be complete different protocol. Then from Candina Kusuma, I've used some of Skin Booster that is also contain hyaluronic acid peptides and lots of multivitamin to restore the under eye hollow of darkness, but the result couldn't last very long, maybe about 3-4 weeks. So going so that you described before, how we make sure the Cell Booster Lift is better. Is there any particular technique? Okay, remember that when we are talking about periocular, we need to understand it's very difficult and multi-factorial processes, because we are going to have volume loss. That is not the indication of Cell Booster. Hyperpigmentation, that it is the indication of Cell Booster. For example, Cell Booster Glow is more indicated for pigmentation, but Cell Booster Lift also has vitamin C. And then we're going to have hyperactivity of the muscles. That the indication will be botulinum toxin. If you're telling me that in this specific patient, after 3-4 weeks, again, the pigmentation is appearing, so probably it's because he's not using proper sun protection, and or he has underlying alteration of the skin, like could be, for example, melasma. So in these specific patients, I recommend to do the treatment once a month to maintain the results. But it's because of the individual characteristics of this patient. Can we combine Spantoms and Cell Booster Lift in one syringe? If you would, you can. So it's possible, but I think it's going to be more effective if we separate the injections, because we give time to each product to make their own activity. How much amount of product you use in every session? So I use normally 3 milliliters for the whole face. So one closed hand will be the measurement for 1.5 milliliter. So if you're using for the neck or décolleté, you will need a little bit more product. Can we use it by dermapen? Yes, you can use it and will be effective, but we are going to get 100% of result if we inject the product instead of just putting it over. So I recommend better to inject. Are you injecting exosomes? There are different ways to make the liver these exosomes. So sometimes you apply topically, sometimes injecting, depending on the recommendation of the exosome brand you're using. Are Cell Booster give more longer result than other Skin Booster? Yes, because it's stabilized, so it's going to be for longer time into the tissue. Can it be dissolved by hyaluronidase? Yes, it can be dissolved. So if you have any adverse event, you can dissolve it with hyaluronidase. It's stabilized, but it's pure hyaluronic acid. So you will be degenerated by our endogenous hyaluronidase. But if you have an adverse event and you want to remove the cell booster from the area, you can simply inject hyaluronidase and will be degraded. It's a very safe and effective product. What exosome product will you recommend to combine cell booster with? Well, it depends on the indication of the patient. We have many in the market, so I think you need to make your own recipe from that and then say, okay, this exosome is specific for pigmentation, this exosome is specific for rodensification, and then combine it with cell booster lift or cell booster glow or cell booster shape, because you have different formulations for different indications. They say, can you inject it into the lips? Yes, you can. But remember that cell booster is not a volumizing product. Can improve the hydration and help with the skin damage, but it's not volumizing. So don't expect a lip augmentation in this case. Are there more local erythema or pain on the combination with exosome or others? Yeah, as I told you at the beginning, I recommend you to do it 1 week apart. So you're not going to have these issues of combining on the same day. Can I add botulinum toxin directly into cell booster lift, similar how you mix with NCTF? Yes, you can. You can if you want to do baby Botox or micro Botox, for example, for the décolleté area, you can combine it. But the effect of a cell booster itself is very good. So I see the questions in Turkish. So I don't know if you can, the translator can help me.
Yes, it was translated. Do combinations not cause side effects due to drug interactions?
Yeah. Okay, so if we don't have more questions, which product will you use for lips? Yeah, it depends, yeah, if of the age of the patient. If I have a younger patient, probably I will use Glow. If I have an older patient, probably I will use Lift. But it's not an indication. Remember that it's regeneration of the skin, so don't focus on injecting in the lip itself.
The question in Turkish is about combinations. Doctor is asking if lift and glow, if combined, can they provoke allergic reaction, and
No.
if there is a possible interactions between products in case of combinations.
No, if you are combining products on the same session, I will do it on a different areas, because a booster glow is more target for hyperpigmentation. So imagine that you have a dark spot on a specific area. So that area I will treat it with cell booster glow, and the rest I will treat it with cell booster lift. We need to understand the product that we are using for the specific indication. You don't have, it's not a contraindication, but from my point of view, you're not going to target properly the tissue if you mix it. It doesn't make sense, because some active ingredients, they will be duplicated and other ones not. So we have to understand that. If you want to combine it on the same session, okay, but I will not do it on the same plane. For example, I will inject Cell Booster Glow with a needle intradermally, and then I will put Cell Booster Lift with a cannula on the superficial fat pad. So if they are not on the same plane, it could be okay. This as the concentration of HA, yes, is 18 milligrams per vial. No, we don't have clinical data about combination with Sculptra. We have clinical data, an article for Dr. Nenan Stankovic of combination with PCL, and we can see that the results of the combination of the products is better than standing alone treatment. So mechanism of action of PLLA, calcium hydroxyapatite, and PCL is more or less the same. Is they are activating the inflammatory collagen production. Would you recommend using cell booster before or after PLLA? I will use it before to prepare the skin. So then a lot of things that will be repaired already. So then the PLLA, even though it's going to make some inflammatory and volume augmentation, the quality of the tissue will be better. In your experience, is there any complication you found and how to resolve? Well, complications, you can have a little bit of swelling after the injection in some patients because of the needle, and you can have some bruising. How I will resolve it? Well, the swelling, you can apply a little bit of cold on the area, not ice. The ice will give more swelling. And for if you have a bruising, some arnica cream or arnica tablets will help to solve it faster. And besides of that, remember, absolute contraindication will be infection on the area. So I will never inject an infected skin. They say because some doctors mix this as a hair exosome powder with actual plasma instead of normal saline. Well, you can do it. Some doctor, you can do what you want. But if now we understand the mechanism of action that is completely different from both, I will let do one product cell booster their activity, and then let the other product to do the other activity. So I will prepare the tissue for a better response from the second product that you want to put that, and this we make it with Cell Booster in the first place. Well, again, this question again and again, yes, if you want to combine it, you can, but I from my point of view, I don't see the need to combine it. And I see another question from Dr. Hussein Haidar that is in Turkish, so somebody can help me. Okay, so what is your recommendation after the initial protocol? What should be the interval? Okay, this is a very important question, and you always need to adapt to the patient. Okay, so some patients, like this question we had before, they will need a treatment every month, or if they have any underlying problem, like for example melasma or a specific type of dermatitis, I will do it more often. But generally, the maintenance, it's enough once every 2 months. This product is stabilized, so it's going to stay for longer time into the tissue. Okay, so if we don't have more questions, I thank you very much. It was a pleasure for me. We ran 5 minutes late, so I'm sorry about that, but I want to give time to answer the questions. The questions I couldn't answer, I'm sorry, because I cannot understand the Turkish. We will answer later by email, or you can ask your distributor, and then will be answered to them by writing. Thank you very much. It was a pleasure. This webinar will be available online, and hope to see you soon around the world with more information and more publications of Cell Booster. Have a nice day. Thank you very much. Bye-bye.